Okay, in this video we're going to talk about ulcerative colitis, a tale of two patients. First of all, and by the way, you see my new background? I got the School of Athens behind me. It's a little bit small, so I got to be up close to make it fit. But anyways, first of all, before we talk about ulcerative colitis, you have to know the surgery for ulcerative colitis. So this is what is called a total colectomy, meaning the entire colon. This is the colon. Colon looks like a question mark. So here's the right colon, transverse colon, left colon or descending colon, sigmoid colon, rectum. Okay, like a question mark, and the little poop comes out. That's the little dot on the question mark. Anyways, they take the whole colon out. That's a big, big, big surgery. Then the remaining small bowel, distal small bowel, is called the ileum, and they just connect that up to the anterior abdominal wall and make an ostomy. So it's called an ileostomy, an end ileostomy. Total colectomy with end ileostomy. That's a standard surgery for ulcerative colitis. This is conventional medicine approach to ulcerative colitis. Now later on, they can try and take this end ileostomy and then, re-anastomosis, take a takedown of the stoma, and they'll reconnect that, and then they can make the bottom part, they can fashion it into what's called a J pouch, sort of an artificial rectum connected to the anus, as a way to try to restore, fecal continency from below, from the anus. So that's conventional medical treatment right there. They'll try with medications first, and the patient doesn't do well, and a lot of them don't. They end up with this surgery. Okay, and I know, this isn't just something, poor chumps get. This wealthy people who have ulcerative colitis get this too. Okay, so now I just want to talk a little bit more about ulcerative colitis, and then I'll show you the other option for treatment. Okay, so first of all, here is what we were just talking about. They'll have bloody diarrhea. It's part of inflammatory bowel disease, very similar to Crohn's disease. Bloody diarrhea, abdominal pain. The diarrhea can lead to dehydration. They'll get kidney stones. The bloody diarrhea, the blood loss can lead to, anemia. They'll have to take iron pills or something like that. Because it's an autoimmune disease, if they go with conventional treatment, they don't fix the leaky gut problem, they have a tendency to get additional autoimmune diseases. I've seen patients end up also getting rheumatoid arthritis. I've seen them also get hypothyroid or other autoimmune diseases. They'll try lots of medicines to suppress the immune system, to kind of decrease the amount that it's attacking itself, its intestinal, its gut. Aminosalicylates like mesalamine, colizol is a common one. Corticosteroids, again, powerful immune suppressant medications, suppress the immune system. Biologics like Remicade. Medicines like azathioprine, another powerful immunosuppressant. Drug treatment will often fail. They'll have multiple relapses, severe abdominal pain, have to come into the emergency room. And then the decision will be made to treat with surgery. They'll get that total colectomy and ileostomy, and then follow up later with another big surgery with the ileoanal J pouch. Wonderful, okay? So then here's the patients treated by Dr. Mcdougall. Dr. Mcdougall has lots of these testimonials on his sites. Overcame ulcerative colitis, will never return to eating old habits. Look how happy she is, okay? What I'm trying to say is, why get major freaking surgery when you got a good chance to cure the thing just with a low-fat vegan diet? Okay, it's kind of like open heart surgery. Why go for open heart surgery, which doesn't increase your longevity, when you got a good chance to cure yourself with a low-fat vegan diet? It's not a guarantee that it's going to cure you, but the sooner you try, the better chance you have. And then you have a chance to avoid all the complications, like potentially ending up with other autoimmune diseases, kidney stones, etc. Okay, here's another lady, cured herself of Crohn's disease, very similar to ulcerative colitis. Here's another guy, had a dramatic improvement from ulcerative colitis. These are all patients at Dr. Mcdougall. So you just go to Dr. Mcdougall's website called drmcdougall.com, type ulcerative colitis into the search menu there, and you can see all these patients. He's got tons of these. That's why Dr. Mcdougall was the greatest doctor who ever lived. He's curing all these patients. He's not, doing major, severely mutilating invasive surgery that's going to have a big effect on the rest of life. He's just saying, here, eat the low-fat vegan diet, you're better, okay? So be aware of this, because there's a lot of things like this. And this is kind of what it comes down to. If you're smart, you learn about your disease and you see if there's an option to cure it, like there is in these cases. If you're a chump, you just take a bunch of pills, lose all your money, get really sick, and then you get big operations down the road, high risk of that. So anyways, hope that was helpful.